Did you know insulin resistance is a global health crisis impacting societies and economies worldwide? Welcome back to the Victory Education Lounge, everyone. I'm your host, Maurice, and today we're diving into part 18 of our series on insulin resistance. Before we begin, please take a moment to like this video, subscribe to our channel, and leave a comment sharing your thoughts or experiences below. Your engagement helps us reach more people with this vital information. Today, we're exploring the global impact of insulin resistance. We'll delve into how this metabolic condition is affecting populations worldwide, its economic and social implications, and what's being done on a global scale to address it. We'll discuss solutions, management techniques, and prevention strategies, along with their pros and cons, and provide real-life examples to illustrate these points. This metabolic condition is more than just a personal health concern. It's a global crisis with far-reaching implications. In this video, we will examine how insulin resistance is affecting populations across the globe, its economic and social repercussions, and the global efforts to address this crisis. We'll also discuss practical solutions, management techniques, and prevention strategies, providing real-life examples to better illustrate these points. Insulin resistance is on the rise, straining healthcare systems, impacting productivity, and influencing lifestyle changes worldwide. It's a complex issue, woven into the fabric of our global society, and it's high time we address it head-on. So prepare to delve into the global impact of insulin resistance as we discuss its implications, solutions, management techniques, and prevention strategies. Insulin resistance is a growing concern, particularly in developing countries. This metabolic condition, once thought to be a problem primarily in the developed world, is now spreading its roots far and wide, affecting nations across the globe. It's startling to see how rapidly insulin resistance is growing, especially in parts of the world where it was once relatively uncommon. For instance, the prevalence of insulin resistance in India has seen a dramatic increase over the last 2 decades, doubling in number and affecting both urban and rural populations alike. This rise is not exclusive to India, but is a pattern we're seeing in many developing countries. Rapid urbanization, changes in dietary habits, and a more sedentary lifestyle are among the contributing factors to this increase. As people move from rural to urban areas, they're exposed to a different way of life that often includes less physical activity and a diet rich in processed foods, both of which can contribute to insulin resistance. In addition, the adoption of westernized diets high in processed foods and low in nutritional value has led to an increase in obesity rates, a significant risk factor for insulin resistance. In Mexico, for example, the adoption of a more westernized diet has led to one of the highest obesity rates globally, which has in turn increased the prevalence of insulin resistance. As we can see, insulin resistance is not a localized issue, but a growing global concern. The ripple effects of insulin resistance reach far beyond personal health. Indeed, the economic and social impacts of this metabolic condition are immense and far-reaching. Let's begin with the economic burden. Treating insulin resistance and its complications isn't cheap. Healthcare systems worldwide are strained due to the high costs associated with the management and treatment of this condition. For instance, in the United States, the annual cost linked to diabetes, often a result of insulin resistance, exceeds $300 billion. That's a staggering figure, isn't it? But it's not just the direct cost of medical care that's a concern. This brings us to the issue of productivity loss. Insulin resistance and its related conditions, such as type 2 diabetes, can lead to significant workforce productivity losses. People living with these conditions might need to take time off work for medical appointments, or they might experience decreased productivity due to health complications. In the United Kingdom, for example, it's estimated that diabetes causes 15 million lost workdays each year. This not only affects the individuals and their families, but also has a significant impact on businesses and the economy as a whole. It's essential to remember that the economic burden and productivity loss associated with insulin resistance don't just affect the individuals living with the condition or their immediate families. They impact societies and economies on a grand scale. Businesses can suffer due to decreased productivity, and healthcare systems can be strained under the weight of treating and managing these conditions. And let's not forget, the social implications of insulin resistance are significant too. People living with insulin resistance often face social stigma and discrimination, which can lead to decreased mental well-being and quality of life. In conclusion, the economic and social implications of insulin resistance are staggering. impacting economies and workforces worldwide. This is a global health crisis that requires our urgent attention, not just for the sake of those living with the condition, but for the well-being of our societies and economies as a whole. Our changing lifestyles are fueling the insulin resistance crisis. As the world urbanizes at an unprecedented rate, our lifestyles are transforming dramatically. This urbanization is not just changing our landscapes, but also our habits, behaviors, and ultimately, our health. One of the significant changes brought by urbanization is sedentary living. As we move to cities, our jobs often involve less physical activity. The manual labor of farming is replaced by desk jobs, and the active lifestyle of rural living is replaced by the convenience of urban transport. This shift to a more sedentary lifestyle significantly increases the risk of insulin resistance. In addition to reduced physical activity, urban living also influences our dietary habits. The hustle and bustle of city life often lead to a reliance on processed foods that are high in sugar and unhealthy fats. Fast food chains, convenience stores, and vending machines are now ubiquitous in urban landscapes worldwide. These dietary changes, coupled with a lack of exercise, create a perfect storm for insulin resistance. Let's look at China as an example. Over the last few decades, China has undergone rapid urbanization. The once predominantly rural population is now largely urban. This shift to urban living has led to a dramatic increase in sedentary behaviors and processed food consumption. And with these changes, there has been a corresponding rise in insulin resistance rates. But it's not just China. This pattern is repeated in countries across the globe. From the skyscrapers of New York to the bustling streets of Mumbai, our urban lifestyles are making us more prone to insulin resistance. It's important to remember that urbanization and lifestyle changes are not inherently bad. Cities bring many benefits, including access to healthcare, education, and economic opportunities. However, these benefits should not come at the cost of our health. We need to find ways to make our urban lifestyles healthier. This could include creating more opportunities for physical activity in cities, promoting healthier dietary choices, and raising awareness about the health risks associated with sedentary living and poor diet. The shift towards sedentary lifestyles and processed food consumption is a significant contributor to the rise in insulin resistance. As our world continues to urbanize, tackling these lifestyle changes will be key to addressing the global insulin resistance crisis. Dietary shifts and healthcare disparities play a big role in the insulin resistance crisis. As we journey around the globe, we can't help but notice the impact of our changing diets on our health. Traditional foods, often rich in nutrients and low in processed sugars, are being replaced by a more Western-style diet high in processed foods. In Mexico, for instance, the adoption of such a diet has contributed to one of the highest obesity rates globally, leading to an increase in insulin resistance prevalence. This shift towards convenience foods rich in sugars and unhealthy fats is a trend seen not just in Mexico, but in numerous countries worldwide. Now, let's pivot to the topic of healthcare disparities. Access to diagnosis and treatment for insulin resistance is not a uniform luxury enjoyed by all. It varies greatly between and within countries, often dictated by socioeconomic factors. Let's look at sub-Saharan Africa as an example. Here, many people with insulin resistance go undiagnosed due to limited healthcare resources. Without diagnosis, there can be no treatment, and without treatment, the condition only exacerbates, leading to further health complications. But it's not just about access to healthcare. It's also about the quality of care received. In many instances, marginalized communities and lower-income populations receive subpar healthcare services, and this is a global issue. It's a vicious cycle, really. These populations are often the ones most affected by insulin resistance due to dietary shifts and lifestyle changes, yet they are the least likely to receive appropriate care. What's more, the economic burden of managing insulin resistance often falls on the individuals themselves. In many countries, out-of-pocket expenses for diabetes care can be financially devastating, pushing families further into poverty. So, you see, the issue of insulin resistance is not just about diet or lifestyle, it's also about the socioeconomic conditions, healthcare systems, and policies that shape our world. The availability and affordability of healthy foods and healthcare resources significantly influence insulin resistance rates. Our environment and genetics can also influence our risk of developing insulin resistance. Let's first take a look at environmental factors. We live in a world where changes in our environment are happening at an unprecedented rate. These changes, which include exposure to certain pollutants, can have direct effects on our health, including our metabolic health. For instance, studies suggest that exposure to environmental pollutants might increase the risk of insulin resistance. These pollutants are not just limited to one region or country, they are a global issue affecting populations worldwide. So, no matter where we live, our environment can play a role in our susceptibility to insulin resistance. Now, let's shift our focus to genetics. Yes, our genes can play a role in determining our risk of developing insulin resistance. Some populations are genetically predisposed to this condition. A prime example is the Pima Indians in Arizona. This group has one of the highest rates of type 2 diabetes globally, a condition often linked to insulin resistance. Research suggests that this elevated risk is partly due to genetic factors inherent in this population. But remember, while our genes may predispose us to certain health conditions, they don't dictate our health outcomes. That's where the concept of epigenetics comes in. Epigenetics is the study of how our behaviors and environment can cause changes that affect the way our genes work. This means that even if we have a genetic predisposition to insulin resistance, we can still influence our health outcomes with lifestyle modifications like a balanced diet, regular physical activity, and maintaining a healthy weight. In conclusion, both our environment and our genetic makeup can influence our risk of developing insulin resistance. However, it's important to remember that we are not helpless in this. We can take proactive steps to mitigate these risks and promote our overall metabolic health. From pollutants to genetics, various factors can increase the risk of insulin resistance. Despite the challenges, global efforts are underway to combat insulin resistance. International organizations, governments, medical communities, and even private sectors are joining forces to address this burgeoning health crisis. One shining example is the World Health Organization's Global Action Plan for the Prevention and Control of Non-Communicable Diseases. This comprehensive strategy aims to reduce the global impact of conditions like insulin resistance through prevention, early detection, and timely treatment. Another significant initiative comes from the International Diabetes Federation, which has launched numerous programs to improve diabetes care, prevention, and a cure worldwide. They're working tirelessly to promote healthy lifestyles, provide education, and advocate for people with diabetes and those at risk. We're also seeing innovative collaborations between governments and the private sector. Take, for instance, the partnership between the Danish government and Novo Nordisk, a global healthcare company. They've launched the Cities Changing Diabetes program, which aims to halt the rise of diabetes in urban areas by addressing social and cultural factors. Similarly, the Global Alliance for Chronic Diseases is a consortium of health research funders. They're working to tackle the world's biggest killers, including conditions related to insulin resistance. Through their efforts, they're funding vital research to understand these conditions better and develop effective strategies to combat them. But it's not just about large-scale initiatives. Grassroots movements are making a difference too. Community-based programs are taking on the challenge of promoting healthy lifestyles, improving access to nutritious foods, and providing education about insulin resistance and related conditions. And let's not forget about the role of technology. Digital health solutions are emerging as powerful tools in the fight against insulin resistance. From telemedicine services that improve access to care to mobile apps that help people monitor their health and manage their conditions, technology is playing a crucial part in global health initiatives. These examples highlight the concerted global efforts to combat insulin resistance. But it's important to remember that this is a collective fight. It requires the participation and commitment of everyone, from international organizations and governments to healthcare professionals and individuals. Through global cooperation and action, we can make strides in combating this global health crisis. Insulin resistance is a complex issue with far-reaching implications. It's not just a personal health concern, but a global crisis that's touching every corner of our world. We've taken a deep dive into how this metabolic condition is affecting societies and economies worldwide. We've seen its rising prevalence, particularly in developing countries like India, where it has doubled in just 20 years. We've looked at the economic burden, with healthcare systems strained under the weight of treating insulin resistance and its complications. In the United States alone, the annual cost associated with diabetes, often a result of insulin resistance, exceeds $300 billion. We've also touched on the productivity loss caused by insulin resistance and related conditions. In the UK, diabetes leads to an estimated 15 million lost workdays each year. We've explored how rapid urbanization and lifestyle changes are promoting insulin resistance. In China, a shift to urban living has led to an increase in sedentary behaviors and processed food consumption, contributing to rising insulin resistance rates. We've discussed how Western-style diets are replacing traditional ones, contributing to the problem. In Mexico, the adoption of a more westernized diet has resulted in one of the highest obesity rates globally, increasing insulin resistance prevalence. We've highlighted disparities in healthcare access, with diagnosis and treatment for insulin resistance varying greatly between and within countries. For example, in sub-Saharan Africa, many go undiagnosed due to limited healthcare resources. We've examined how global food policies and environmental changes may be contributing to the rise in insulin resistance. And we've noted how some populations have a genetic predisposition, such as the Pima Indians in Arizona. Finally, we've discussed the role of international organizations in combating insulin resistance worldwide, like the World Health Organization's Global Action Plan. All these aspects underscore the importance of understanding and addressing insulin resistance. This isn't just about individual health, it's about the health of our global community. By understanding the global impact of insulin resistance, we can better strategize solutions and prevention methods. Thank you for joining us for this global perspective on insulin resistance. I hope this information helps you understand the widespread impact of this condition and the efforts being made to address it worldwide. Remember to like this video, subscribe to our channel, and share your thoughts or experiences in the comments below. Stay tuned for our next video where we'll discuss innovative approaches to insulin resistance management from around the world. The information provided in this video is for educational and entertainment purposes only. It is not intended as medical advice or to replace consultation with a qualified healthcare professional. Always consult your doctor before making significant changes to your lifestyle or starting any new health regimen.